On a dreary day in Cumberland County, Kim White is in recovery mode. The 58-year-old got breast cancer surgery in late August at the IWK, 3 months after a stellate showed up on her routine mammogram, and 1 month later than she says she should have been operated on.
This was mentally debilitating. To not only have to deal with a cancer diagnosis, but to have to deal with a medical system that was biased against you from the beginning.
When doctors spotted the invasive mammary carcinoma on her scans at the Cumberland Regional Healthcare Centre, she was eventually connected with the in-house surgeon. But she says she was told she wouldn't be able to receive her surgery locally due to her body mass index being above the hospital's safety policy.
Being a big woman, you are stigmatized every day. So I've never been one for looking at my weight as a discriminatory mechanism for healthcare, but obviously it is.
White was referred to the IWK 2 hours from her home in Amherst. But she was denied surgery again, this time because her BMI was not high enough for them to intervene. She was sent back to Cumberland for a consultation with an anesthesiologist, but alleges she was met with further discrimination.
He didn't look at any information in my file because he asked me all the same questions. Do you have any difficulty climbing stairs? Do you have any difficulty walking? Do you have difficulty breathing? Those are all weight questions. And then at the very end of all those make me feel worse about myself questions, the answer is no, because we have a policy.
She began phoning the Premier's office and sent letters to the Standing Committee on Health asking it request a plan to close the gaps in breast cancer care, but they decided not to proceed.
Recently, the IWK hired a nurse navigator. This would offer a central point for unattached patients to be able to ensure they receive timely results, referrals, diagnosis, and care. The creation of a breast health research unit is also underway at the IWK. And for that reason, we will not be supporting the motion.
More access and research is vital, experts say, but the province has to scrutinize its existing policies.
Knowing what we know about the accuracy of BMI and knowing what we've seen in systematic reviews about the use of BMI for surgical candidacy, we need to rethink it. A woman should not be regarded only by her BMI for life-saving surgery. There is no way that should happen in Canada. Morally, ethically, socially, we should not be allowing that.
In a statement, Nova Scotia Health says while they can't comment on individual cases, they recognize how vital timely access to surgical care is. Adding NSH does not have a provincial policy regarding BMI and surgical eligibility. Anesthetists generally assess each referral considering multiple contributing health factors to ensure the safest possible care. Patient safety is a top priority, and occasionally a case may be referred to a specialized center if it is felt to be in the best interest of the patient. But O'Rourke believes Nova Scotia's medical system is hypocritical in its policies around BMI.
There shouldn't be an out for a rural hospital set their own policies on BMI that are not scientific or evidence-based. It's something else behind that policy aside from patient safety. Because when there's two hospitals in the same province who are at odds about the patient safety and the BMI, that's an access issue that they're not admitting to.
Access issues White says the Premier needs to address.
Maybe he should start putting in policies and tools in rural hospitals to look after the women in this province.
Resources, she hopes, would allow women with any BMI to receive timely surgery.
You have to rely on your healthcare system. But when that healthcare system fails, it costs people their lives. It's costing women their lives.
Ella MacDonald, Global News, Amherst, Nova Scotia.